This morning, I got an AI-generated chemo protocol for a breast cancer patient. It looked clean, fast, logical, but something about it didn't feel grounded. It skipped over a nuance I knew mattered. That's when I hit pause. So I pull up NCCN guidelines and, yep, our AI skipped a recommended dose adjustment. Not malicious, just incomplete. That is the risk. Not errors, oversights. I've started treating AI outputs like a consult note, not gospel. I'm the one who signs off, not the model. Trust your training. Use the tool, but the final call, that's still yours. Curious how you'd handle it. Ever run into something similar? Drop your take in the comments. We actually read all of them. And hey, if this got you thinking, hit save or subscribe so you don't miss the next video. We've got some eye-opening insights and game-changing ideas coming your way.